Hi everyone. In this clip, I will talk a little bit about mammograms. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. A mammogram is an X-ray of the breast that can help detect breast cancer and other conditions. So mammograms can be used for screening or diagnosis. A screening mammogram is an X-ray of the breast that can detect breast cancer before symptoms appear. It can also detect microcalcifications, which are tiny calcium deposits that may indicate breast cancer. This kind of mammogram usually gets recommended to women who are at least 40 years old. A diagnostic mammogram is an X-ray of the breast that can help diagnose breast problems, such as lump, nipple discharge, or skin changes. It can also help evaluate changes found during a screening mammogram. During a mammogram, the patient removes clothing and jewelry above their waistline and stands in front of the X-ray machine. A technologist will compress each breast for 20 to 30 seconds, and the compression is to spread and flatten the breast tissue, basically. Mammograms expose patients to some ionizing radiation, and there's a debate about the benefits and risks of this procedure, especially for younger women, although I feel it will apply at any age. Thermography, however, is a procedure that has been used since 1956, and it uses an infrared camera to capture images of heat patterns on or near the body. Thermography can be used for medical imaging, and it is even used to assess the condition of buildings and mechanical systems. So we have breast thermography, which is a screening test that can help detect breast disease. It uses infrared radiation to create an image called a thermogram. On a thermogram, hot spots appear red while surrounding tissues appear yellow, green, or blue. The principle of infrared thermography is based on the physical phenomena that any body of a temperature above absolute zero emits electromagnetic radiation. There's a clear correlation between the surface of the body and the intensity and spectral composition of its emitted radiation. Thermography used for early detection can be life-saving for women at risk of breast cancer. Thermography can also be used to detect other conditions such as thyroid dysfunction, musculoskeletal injuries, dental inflammation, and so on. It is also a useful tool for monitoring healing progress and evaluating the effectiveness of the treatments that are being given. Digital infrared thermal imaging is the thermography used to diagnose breast cancer. This method shows high accuracy and is very cost-effective from the form of diagnosis. The concept behind this test is that as cancer cells multiply, they need more oxygen-rich blood for growth. As there is an increase in blood flow to the tumor, the temperature around the tumor also increases. Malignant cells discharge nitric oxide in the bloodstream and cause impairment in the microcirculation. This released nitric oxide, along with the active growth of the cancerous cells, increases blood circulation and temperature in that particular region. So therefore, evaluating these differences in temperature will lead to the detection of the malignant region in the breast. Thermography and ultrasound are both non-invasive imaging techniques that can help detect abnormalities in the body. Ultrasound uses high-frequency sound waves to create images of the inside of the body. This can help determine if a lump is a solid mass or a fluid-filled cyst, let's say. Ultrasound also is able to detect some tumors that are missed by mammogram. So after any mammogram or thermography, if there are any doubts, ultrasound is going to follow. So why not start with this less invasive form of detection instead of squeezing the breast through mammogram? Also, as per Johns Hopkins Institute, among all breast imaging modalities, MRIs have been shown to demonstrate the most accurate extent of disease of any of the breast imaging techniques. Just by 2 cents worth, every screening has its strengths and limitations. Since no breast test is 100% accurate 100% of the time, a multimodal approach using thermography and ultrasound together undoubtedly will increase your chance of detection. Hope this has been informational. Like and follow for more. Be the light.